We can make a reasonable projection that we will know by sometime in November or December whether we have a safe and effective vaccine. It is conceivable, though unlikely, that we will know before then, like in October. But I think the best bet is that we will know in November and December. Now, there's never a guarantee that when you know that it's going to turn out to be a safe and effective vaccine. But I feel cautiously optimistic based on the animal data as well as on the preliminary phase 1 data, which indicates that the people who've gotten vaccinated are making rather robust antibody responses that are commensurate for what we see with natural infection. So that's usually a predictor that the vaccine is going to have a good effect. So you put those two things together, that we should hopefully, and I think likely, will have a vaccine by the end of this calendar year, end of November, beginning of December. Already the federal government has pre-ordered to be produced large numbers of doses. So by the time we get to the end of the year, the beginning of 2021, we will likely be able to start vaccinating people. We won't be able to vaccinate everybody in the United States, but you could start vaccinating people like healthcare workers who need a vaccine because they're putting themselves in harm's way by taking care of sick people, as well as people who are vulnerable to the deleterious effects of infection, like people with underlying conditions, the elderly, et cetera. So the timeline I just mentioned is a realistic timeline. Am I concerned about public perception? Yes, because there are some people who may not trust the process and may not want to get vaccinated. That would be really tragic if there were a vaccine that was safe and effective, that could save lives, and people, because of their lack of trust and authority, would not want to take the vaccine. That would be an unfortunate situation. So the chances of there being secret hanky-panky are almost zero because everything is going to be transparent.
So are you so confident that you would line up to be one of the first to take this vaccine in January if it were available?
If I saw the data, which I likely will, and I was satisfied with the decision of the FDA, which I think I will be because it's going to be made by career scientists, I would without hesitation take the vaccine and recommend to my family to take the vaccine.